Last but not least, today we're going to talk about reproductive cancers. And again, there's a female reproductive system and a male reproductive system. So both women and men can develop reproductive cancers. Now, what are the reproductive cancers we'll talk about? There are many of them, but we'll keep it limited to what we covered in lecture. Let's go back to the male reproductive system and let's talk about male reproductive cancers. Now, one of the topics we covered when we last talked about the male reproductive system were the accessory glands. Again, we're not talking about the main reproductive tract going from testes, but now we're talking about the glands that secrete fluids and enzymes and other chemicals that help the sperm along their way as they're trying to fertilize an egg. All right, so again, the first gland that it mixes with, so here's our ductus deferens or the vas deferens, and here's our seminal vesicle or the seminal glands. And then you also have your prostate gland. This, again, both the urethra from the bladder and also the ejaculatory duct run through the prostate. And then you also have the bulbourethral or the Cowper's gland. That's also a name you'll see in older anatomy textbooks. And these secretions, so again, you have 3 pairs of these glands in men, and these secretions combine to form semen. So semen is the fluid component. Again, the secretions from all 3 pairs of these glands. And semen plus sperm, that mixes to form the ejaculate that eventually comes out of the man's penis. Now, what we have here is the prostate. And the prostate, why is it important? Well, a type of reproductive cancer can develop in the prostate gland. So let's talk about prostate cancers, or I'll abbreviate as PCA. So the biggest risk factor is age. So young men don't typically get prostate cancer. It's not impossible, but it's very atypical. Again, the median age is about, average age, at least in the United States, is around 66 years. So nearing retire, when a man's nearing retirement age in the United States, although now retirement's around 70 because again, everything's more expensive. But anyway, so again, this happens typically to elderly men. It's rare in men that are under 40 years old. So again, it is possible, but it's very unlikely to get prostate cancer at a very relatively young age. Now, what about prostate cancer? So we know it develops in the prostate, but what about it? So one classic sign of prostate cancer, one common a phenomenon that happens in prostate cancer is the increase of 5-alpha reductase. And again, it ends in ASE, so that means it's an enzyme. What does this enzyme do? Now, this is testosterone, which again, androgens is the category, but testosterone is a specific chemical that is an androgen. So 5-alpha reductase actually converts testosterone into dihydrotestosterone. Still an androgen, but actually binds to the androgen receptors in cells more strongly. This is actually a more powerful androgen, so it causes more androgenic activity. So it converts, again, this enzyme is important because it converts into more potent dihydrotestosterone. So the thing about prostate cancer and 5-alpha reductase and dihydrotestosterone, well, the androgen receptor, if it's androgen receptor positive prostate cancer, in other words, a prostate cancer that has androgen receptors in it, it's going to actually cause the prostate cancer to divide even faster and grow at a more rapid rate. So if you have a lot of testosterone and this prostate cancer has the receptor for testosterone and dihydrotestosterone, it's going to grow at a more rapid rate than if you didn't have the androgen receptor or this increased DHT. You also have increased aromatase. And again, remember, we talked about theca cells and granulosa cells. This is the same enzyme, but now we have it in men. So remember, aromatase converts androgens, again, the category, into estrogens. So here's androstenedione and here's testosterone. What does aromatase do to these 2 androgens? Well, again, aromatase converts androgens into estrogens. So androstenedione is converted to estrone. Again, that happens at theca cells. Testosterone is converted by aromatase into estradiol. And remember, estradiol is the most powerful estrogen in the human body. So again, what happens? And there's also increased amount of this prostate-specific antigen. Again, look at the structure. Does it look like a steroid to you? It's not really a steroid, but it's an antigen. Again, like this is something you can detect via antibody. So it's something that the prostate naturally produces, but as you can see here, it's a protein. It's a polypeptide, it's a ribbon, it's not a typical steroid. So these are increased 5-alpha reductase, increased aromatase, increased prostate-specific antigens. These are all classic signs and phenomena that occur with prostate cancer. But the thing is that this appears. So the thing is that if you're in older men, a common test, like especially if there's signs of like BPH or prostate or benign prostatic hyperplasia, or if they think the doctor does a rectal or a prostate exam and thinks, oh, there might be prostate cancer, they might order a PSA test to detect the prostate specific antigen. But the thing is that PSA also increases in other diseases or other conditions of the prostate.